the worst and one of the most dreaded things as a parent from a mom and a pediatric nurse practitioner. I am just gonna share a few tips on teething. My biggest thing with teething, and the thing that I use the most as a mom that does focus more on natural products, holistic living, is I do use more natural remedies for teething. I don't prefer an alternative for teething is Earthly Teething Tamer. This thing is amazing and I truly think that it works. My kids have had great benefits and I have seen great improvement in this from teething. And then on top of it, I will use Feel Better Faster from Earthly to help with the fevers if they have it. The biggest things with teething who tend to disagree with is we typically say a fever over like 101 shouldn't be related. However, my kids have had fevers that high with teething. Now with that being said, if you have any inclination that there's something else going on or they have an ear infection with the teething, then yes, get them looked at. But I have definitely seen kids and have had my own kids that have had nothing else that is wrong with them and still have had a really high fever from teething. The other thing is that kids can get ear infections or are more prone to get ear infections with teething because runny noses and congestion can come with teething because there's a lot of drooling and just things that are coming in. So obviously drooling is a big sign of teething. So he's also just cranky and needy and wants to be held all the time. But he's currently congested and he's teething. Now he might have a virus too, but lots of times kids will tug at their ears when they are teething because of the pressure from teething. Also the most fussy prior to the teeth coming in. So usually a week or two before those teeth are actually starting to pop through the gum is when they're the most fussy, which is sometimes misleading for parents because they don't often see the teeth. So then they're like, well, they're not teething, I don't see anything. But it's because they are teething, we just don't see anything yet, which is when they're the most fussy. There also can be clear fluid for ears, behind the ears, for up to sometimes 3 months. It's called a serous otitis, where there is just continuous fluid behind there, but the eardrum's not bulging and it's not pussy fluid, meaning it's not infected, but they can be tugging at their ears and bothersome and it can be uncomfortable for a while. And that can be when kids are just chronically congested or when they're teething. The other biggest thing is that drooling, and that drool going down the back of their throat can lead to loose, runny stools. So diarrhea and just sometimes like throwing up or tummy upset can also be caused from teething as well because of all that extra gunk and drool that's going down and upsetting their stomach. But I hope that this is helpful, and if you have any questions, feel free to leave them in the comments below.